Hello, Marie.
Hi, Steve. How you doing?
Hello. Good. Thank you very much for joining me. I wanted to ask you a few questions about your experience with HelloNote, and I know you recently received an audit from Medicare, and you passed
Yes, I
with
did.
flying colors, so that's awesome.
Yes.
If you don't mind, we have some few questions, but before we begin, just introduce yourself and what you do, where you're from. Yeah, anything you want to share.
Okay. My name is Marie. It's a long name, but I preferred Marie Carmel. But everybody call me by Marie. I'm an occupational therapist. I've been in OTL for over a decade. And the great thing about being an OTL, I love my job, and I'm a great advocate for for OT in general, and also for my clients, for everybody that I touch, caregivers. I love to advocate, put the word out. So basically, I own my own business, and the name of my business is AnneRose Occupational Therapy Services, LLC, but I have to add up the DBA and Rose Therapy and Health Services, because now I do OT and PT at the same time. I'm kind of like new, but I'm moving forward and getting more productive. And the reason why I was able to do all of this is just because of the data system that I'm using. Because one of the things I worked in many places, inpatient, outpatient, do home health, and I know about over 2,000 like system database. And when I started my business, and then I really took the time. That was the part that took me the longest to basically research which data system I will be using. So I kind of like talked to a lot of people, trial and error, I even tried with one of the database and I pay some money. And I realized that what they say, it wasn't what it is, because once you get experience, you know the database and you know exactly what you're looking for, what is good and what is not good. So one Kara, actually, she's one of my mentor, like helping me putting my organization together in South Florida, because I'm located in Boca Raton, South Florida. And I called her and then I talked to her. I said, Kara, my hardest part in building up my business is to get a good data system, because I'm pretty picky, because I know I have been working with a lot of database. Right. So she told me, I'm going to refer you to, have you heard about HelloNote? I said, no, I have not. And she referred me to Melanie and you. So you really embraced me, and then you and Melanie, and then you helped me very smoothly, really get me from the starting point to the finish line to understand what was going on, although it didn't take me too long. But I love to ask questions. I know I was a pain at the beginning, but
that's what we do. So yeah,
I love
that. That's a great point, because questions, I think, is part of it. We're all therapists and we're trying to help other therapists, right? Essentially, at the end of the day, this goes back to helping the patient. Right. So if we as therapists aren't advocating, aren't networking and providing help to fellow therapists, then essentially we're not helping patients either. So I love that. So thank you for mentioning that. But if you have questions, us, we'll always be happy to help.
I know. But now I'm a pro, I'm actually trained.
So
if I refer someone to you, they come to me, they say, Marie, can you help me? I will, for example, my colleague, like the PT that I referred to you, I stop by. I say, what is it you're having problem with? And I stop by, because sometimes on the phone it's so hard to show them what's going on. And then I said, oh my gosh, it was so easy. I said, yes, HelloNote is one of the easiest data system I've seen, because it's easy. Once you get it, because everything is on the tip of your finger. And that's one of the reasons why when I got audited by Medicare last year, I was not really too much panicky, but it was my first time, my first experience. Yes. So I said, okay, what do I need to do? And I called Melanie and I said, Melanie, that's my first time. I'm new to that. So what is it really they're telling me with this letter? And then she was so kind, she said, Marie, it's pretty simple. Everything you're going to do it, you can do it by yourself. And she explained to me what was needed. Like, I went on HelloNote. It was surprising. It was really, really excellent. Every single record that I needed was right there on the tip of my finger to print them out, because Medicare wants hard copies.
Yes, yeah.
So that's the scary part. So I get to organize. I set up an outline of what they requested, and then with HelloNote, I was able to go to the patient's data. Each patient, you can run the report and see when you have the progress note, when you have your eval, your progress note, your recertification, and then one after the other one. And I was able to do it like in less than a week to put everything together. And after that, I sent it over to them. The only thing that the lady called me, said, Marie, there is one patient. It seems like I don't have the progress note for it. But the thing is, it's like while I was printing so much. So one data, it's manual, it's not computerized. So I mixed it up, and then I said, no, I have it. And I said, give me like less than half an hour. I'm going to send it. She said, you don't have to mail this. Just fax it to me. She called me back on my way after I faxed it. And then she called me. She said, Marie, I don't know what you're using, but that's the first time she have ever seen someone, like a small company, having like good record keeping.
Wow.
Good record keeping. It was excellent. She called me. She had a long conversation with me. And I said, you know something, I'm going to put the word out. I have to tell, the owners, and then they're doing a great job, because it's so easy to kind of like get your every single data from your specific patient together without the struggle, of looking for this here, looking for that here. And the good thing about it, you can also, like, for example, I know that there was one thing that one of the doctor was very sick, and then she was out of practice because I think she went to have a baby, and then she got sick, and then she was out for months. And I didn't have one signature. And all I have to do is just like go to, like, when I call, and then show the fax. That's the best thing. When you go to fax, and then you get the record of your fax within HelloNote, that was the greatest thing ever. And I print out the fax. It's proof that I've been trying, I sent it to Medicare. I said, yes, this is the fax showing that, I've been trying, but the doctor was not there. She was not available. So I wrote a note. I went to my communication note, and I wrote the note, and then I explained, and then with the fax supporting my document. Every supported document that you need is right there. That's awesome. Wonderful. That's wonderful. Awesome. I don't think with another database, I would have gotten this, like, passing this audit with flying colors. There is no way. You see?
Well, thank you. That's amazing to hear. So thank you, Marie. And I know when you get an audit, especially your first audit, especially for Medicare, it's stressful, and most of our clients, they panic. And I love the fact that you said you didn't panic, because you had everything in the system. Yes. It was a matter of how you get it to Medicare.
Yes.
And it seemed like you were able to do that. And even Medicare was impressed.
They were impressed. Like the lady said, what do you do? How do you keep up? I said, yes. It's like HelloNote, the data system that I use, have everything. I said, you should see actually my billing. My billing is just a click on my fingers.
Right. Yeah. No, that's awesome. Thank you very much, Marie, for sharing. I have a few more questions, if you don't mind. So what are the most useful features that you find in HelloNote?
Just to tell
aside from billing.
Yes. Just to tell you the truth, I know billing is a great one. It's already a given. The therapy invoice, I don't know if you will put it under billing, but the therapy invoice, it doesn't take me too long. No matter how many therapies you have, it doesn't take you too long to just like get your invoice in place,
Right.
So I feel like that's one of the things that I would have paid a lot of money to somebody, to an accountant or to somebody else to just sit down and do the payroll for me. Doing the
Right.
payroll for me, it's my leisure time, actually.
Yeah.
It's my leisure time because when
Mhm.
I sit down, I usually like sit down and then I said, okay, I have my lineup of therapies. And then I said, okay, let me just see what is it for the pay period. The good thing I love with the therapy invoice, it really make you stay in compliance with everything. Because if you do not write your note, you do not finalize your note, there is
Correct.
no way
You
I
can
can
get
pay
paid.
the invoice. At the
Right.
beginning, some staff will call me, say, Marie, you didn't pay me. I saw the patient. I said, okay, give me 1 second. I said, go on the computer. I'm going with on the computer with you. And we look at it and we said, okay, when did you enter your note? The note was late. So it's self-explanatory. So like you don't have really to tell much to the staff to show them,
Right.
okay, that's you. It's not me because HelloNote, the system only allow me to gather your information to pull out your invoices when you finalize your note. And
Correct.
again, this is something I feel that kind of intertwine and make it very, very good for
Yeah.
staff to know that, to learn by their own, that I have
100%.
to be on the top of my game because
100%.
otherwise I'm not gonna get paid.
Yep, and that's exactly what a lot of other clients say, is that in the beginning, therapists were late with notes, but then when they start realizing they're not going to get paid this cycle if their note's not done, all of a sudden everyone's doing their notes on time.
Yes.
So that's a good point. Yeah, we actually use that feature a lot too, especially if you have contractors. It's a huge time saver. So yeah, that's awesome. Thank you, Marie. Another question: how easy was it for your staff and therapists to adjust to HelloNote if they haven't used it before?
Something, it wasn't hard at all because my staff, when I started, I always tell them, I said, listen to me, no matter what system you've been using in the past, once I teach you how to use it, it's going to be the easiest one for you to use. And they all came back to me. They said, Marie, you are right. This is the easiest system that I'm using.
Awesome.
They understand, like yesterday, I'm bringing a new physical therapist. And then I went to Barnes and Nobles and then I opened up my computer and I was showing like a demo of what. I said, Marie, it seems easy. I know it's my first time. I saw a lot of things, but I know it's easy because from the way you're doing it, the way you're explaining it to me, I know I'm gonna get it quickly. I said, no worries.
Wow.
No worries. Yesterday, I was doing it again with one of my staff. And every staff who come on board, I always try to sit down one-on-one with them. And I told them, your first note or your first evaluation, call me. I'll walk you through it. Once I walk them through it, they say, Marie, I got it.
Yeah, no, that's awesome.
It's so easy.
That's really awesome. And then you also have those templates that you can save. You can name it something like shoulder pain,
Yes.
CVA, lower back pain, hip replacement, whatever you want. And then you can pull those templates up for another patient and then modify what you need to modify. But at least a lot of the core from the template is retained. So
very
it's
good,
time
very
saver,
good.
so.
And that's one of the feature I show the new physical therapist. Actually, she's not new to me because we work together at other places. We used to be a very good team together. So
Awesome.
she's willing to help me on a PRN basis. And then she said, Marie, I was showing her the templates. She said, wow, that's great. I said, you can create whatever templates that you wanted to create. She said, I know already what I'm going to be creating, so.
Yeah. And it's great because in HelloNote 2.0, we're actually going to allow different therapists to share their templates with other clinics. So this way we have a data, as long as, of course, they consent to it. So you'll be able to share your templates with others, and others can share it with you because we're going to have really nice custom built templates. So thank you. That's excellent feedback.
That's wonderful. I really love it. That's wonderful. It's gonna be nice.
Awesome.
It's gonna be
Thank you. Thank you. So next question is, and what recommendations would you have to others that are going through their first audit?
For people who are going through their first audit, they have to be one thing, don't panic. It's easy to get panic because you might say that when you run like your report and then you see that, oh my gosh, I missed this signature. They never sent me this, they never sent me that. It's okay. It's okay because we're doing a lot of things, although we have a good record keeping, but at the same time, we are human. We're going to miss. Sometimes you may do an evaluation and you think you click the button to fax it to the doctor, but you never did until you run the report and then you try, and then you see, oh my gosh, I'm almost 30 days. You know, one great recommendation I will tell everybody. Try on a monthly basis, before the end of the month, try to run a report of all the facts that you send to the doctors. Every single fax that you send to the doctor, run them, and then you will get the report, all the missing signature. That's the name of it. It says like, not with missing plan of care signatures report. Run this report, because this report, you can go up to a year, you know, and see everything that is missing. And that's the beauty of HelloNote again, because you can go a year and then get, oh my gosh, I thought you know, so this will keep you in line and give you the peace of mind, so you will not miss any documentation, any plan of care signature. If they are late, it's okay. The doctor will not backtrack it for you, but the doctor will sign it. And then with that, you can write a note saying that, you know, probably that's what happened. And then they understand. When you write like a note and then you say that this is the event that happened, that's why we missed this signature. It's okay for Medicare as well. So everybody who's going through an audit at this time, do not panic. Take it easy. And then if they are using HelloNote, it's always good. You know, they can contact you guys if they're not clear about like something on the communication note. What do they need to write? They can always call and ask advice, because I feel like good communication, like all around, is the key, you know, to success, especially to pass an audit, you know. And to pass an audit, all you need, evaluation, progress note. Your progress note is within that 10 visit, you know, the 10 visit is max. And the great thing with HelloNote, it counts the visit for you.
Yeah,
you don't really have to count it, because I work with a lot of system where I have to go myself 1, 2, 3, 4, 5, you know, counting, and you can miss. But HelloNote, once you get the visit, it tells you the 8th visit, it tells you a progress note is needed. These are the little reminders. I feel like this is the strength. It's a very, very strong compliance, that component you have in HelloNote. The 8th visit, it said progress note is needed. Either the coda, either assistant, PTA's coda, they will call their supervisor and say, you know something, I cannot go because you have to do the progress note. So this, you get it, you nail it here, right there.
Awesome. Thank you. Yeah, no, that's great. Yeah, the prompts for the compliance is really important. Because sometimes, as you said, what you said earlier is amazing. We are all human, right? And we're not robots. We can't remember everything. And that's why we modeled HelloNote based on feedback of therapists and insurance guidelines and compliance, because of exactly that. We are human. And I love what you said about the faxing the plan of cares. If you fax a plan of care and you didn't get it signed, and Medicare comes to you and says, what happened? You go to HelloNote, you pull up your eFax list, and you could show that you attempted to fax it, and then you write a communication note to state that you attempted, you know, and multiple times and so on. And Medicare is okay with that, you know, because we did our part. As therapists, as clinic owners, we can only do our best. But if it's not signed for whatever reason, at least we have it documented and the system tracks it for you. So I love that. Yes, we are human. And that's why HelloNote exists, is to minimize the amount of things you have to remember, because at the end of the day, we want to treat patients, right? That's why
we want to.
Yep, that's why we went into this profession in the first place. So good, awesome. Thank you, Marie. And let's see, a few more questions. I know you mentioned the HelloNote support team and the team at HelloNote in general was is helpful to you if you have any questions, correct? So
Yes.
does that include any questions with the system, questions in general about your business and auditing and billing, or is it only one or the other?
You know, basically, just to let you know, at the beginning, like when I was new to HelloNote, although I had a good grip about the system, but the little details, sometimes, like for example, if I'm running a billing and then I miss a payer ID, and at that point, I didn't know how to go and connect the puzzles. And I will call, and then everybody there, they will try to explain to me. They said, okay, this is the step that you take. You know, you can go, you add up the payer's ID. You know, now I'm a pro. I can do it.
Yeah,
you know,
once
but
you know,
I
you know,
called
right?
many times. I know that I called many times. I said, okay, because the thing is, you don't have the same mistake over and over, like back to back. You may have this mistake here, and after 3 months, you have it again. So if you don't take notes, and that's why you take note, like I said, okay, I'm going to take note, payers ID, this is the way I got it. And then also, one of the things, not only for the billing part, for the payers ID, it's also for the notes. Sometimes I might be doing something with my notes, and I found out that, oh, I made a mistake to create my first addendum, although I have it written, and it didn't really make too much sense to me. And then I called, and they were so patient and explained to me, that's the way you create it. Since that day, I never forgot. And then now I'm just like, going and then teach all my staff how to create an addendum. I told them it's okay, you can make mistakes, but you can still create an addendum to justify how you do it, you see? So saying that, I can say that HelloNote support, it's not only for the system itself, I use it for the billing, I use it like sometimes for my company. I wouldn't say too much, I would say a little bit, because one of the things I contacted HelloNote for about my company, when I was trying to set up my intake forms, and this is when I call and I say, how do I get my personalized intake form into the system? So that's one of the things that was specific to my company, because I want, if I send my form to my patient, so they can kind of like use it and then send it back to me. So this was one of the thing that I did specifically for the company, but mostly I will be calling for about just little details, not
that's perfect. Yeah. No, thank you. That's good. And what you said is great, because if you don't ask and you have to figure things out, sometimes it's going to cause you to be frustrated or spend more time that you need. So it's great that you reach out, because once you reach out, you learn, you know it for forever, right? You don't have to come back to it and relearn it. And as you said, you are now training your own staff on how to do it. So yeah, that's awesome. That's a great point. Thank you. And last question. So do you have any advice for people that are looking for an EMR, and if HelloNote is a great fit, and any advice that you can give to someone that's currently exploring options for EMRs?
Anybody who are exploring to work with any EMR, I will first ask them, do their research, because if you don't go and pick something just because you want to pick it, it's cheap, or it's it gives you this. They brag about giving you certain thing until you get it. I will definitely encourage them first to do their research, do their own research. And there's a specific database where you can go, you can look at them and see, but don't even trust them, because it's a marketing scam, I would call it. It's a marketing scam, because who has more money, they are going to be at the top. That's the way it is, until you get yourself trapped. I will definitely encourage anybody, try HelloNote first. Try HelloNote, because the reason why, it's simple, it's convenient, and like I told everybody, I'm telling them, HelloNote is built by therapists. by
That's
OT, PT,
right.
speech. So they really know what we are looking for. They understand our needs. It's not like anybody or they pay some computer guy to do. It's
Exactly.
just
Yeah.
like the therapist, they take as a therapist and they place every single thing with compliance, with Medicare insurance compliance. So we do not kind of like put ourselves in a corner or in like issues, having concern, having worries when it's time for us to get audited or when it's time for us to pull out a report and we cannot find it. And also the beauty about HelloNote, one of the things that was really, really painful for me when I was working before I owned my own company. I work in the rehab a lot, and also I work doing home health. And I use the biggest, largest database that you may know as well.
Not
And
saying
one of the
anything.
things that they don't have, we don't have to say name.
Yeah. Yeah.
One of the things, all of them, recurrently, I will be sitting down late, writing my notes. Every note disappear. They don't have the auto save.
Oh, the
This auto
auto.
save, I kind of like tell everybody, please get something that have an auto save.
Yeah.
If you are a good therapist like me, I write long notes. So if my note, I'm at the end of my note, many times I lost them and I have to cry,
Yes.
I
Oh,
don't
yeah.
want you to get into that pain because it's hard.
We've all been there, especially I remember, when we were students, imagine writing all those essays and papers and sometimes did not save, the computer shut off, whatever happened, and you lose that. So yeah, autosave in general is very good.
It's
Hello.
very good, but not all the big company has it. They
Yeah,
don't. They
that's
don't.
a good point.
I think it's an extra money, so they won't
That's the
have it.
one.
So
Yeah.
basically, I will encourage everybody who's exploring to have an EMR to really think it through. Try HelloNote. You can try a couple more, and once you compare them, you will see which one is the best for you. Because HelloNote for me, it's like one of the best. I told everybody it's one of the best. And then where I am in South Florida, in Boca Raton, I always tell people, like every therapist I work with, I said, you know something, try HelloNote. You will
Yeah.
see.
Awesome.
If you enter in your note, your evaluation, it's well structured, very easy to do. And then the good thing, all your assessments are integrated into the system.
Yeah.
And the best thing about HelloNote support as a recommendation to people who exploring to purchase an EMR, when you go, you're doing your evaluation, all the assessments are right there
Yeah.
for you to use. It's integrated. You don't have to pull your assessment here or there or use a hard copy. You have it right there at the tip of your finger. So this is a great feature. These are great features. HelloNote has a lot of great features that I think every single good therapist will be thrilled, will be excited to use, So I don't know if I can say more. Because I just
Good.
love the
No,
system.
that's it.
You know?
We just wanted to hear just from your experience about HelloNote and the audit, because I know a lot of therapists out there, they didn't even get their first audit, and it's always on their mind. So just wanted to chat a little about that, ask a few questions, but it was definitely great interviewing you, and I know we speak here and there, so it's always a pleasure to speak to you. And as you said, it's good to do your research. HelloNote might be great for you, it's great for others, but you actually have to schedule a demo and see if it's the right fit for you. Our goal at HelloNote is to make sure that it's a right fit for you, but at the end of the day, it's your decision, right? So if it works for you, amazing. If it doesn't work for you, just give us feedback, tell us what we're missing, what we don't have that you're looking for, and we'll be sure to improve it because, as you know, Marie, we always listen to feedback, right? So that's another thing. We always update our system based on feedback. Right. So thank you very much for being integral part of our system and building a community. As usual, any questions, let us know. And I appreciate your time. And thank you for being a part of our system.
Thank you so much. It's a pleasure. It's a pleasure talking to you face to face, actually, on Zoom, you know.
Yeah,
And it's a
always.
pleasure also to let you know, like, how much, you know, I really enjoy working with the system. The system is perfect. You know, it's a good system. It worked for me, like you said. You know, it
Thank you
worked for
very
me. It
much,
worked for my
Marie.
staff, and my staff, they love it. You know, they love it. And the good thing, your communicate, like your team support, it's always been from the beginning to today what it is. Like, you pick up the phone, you call, somebody get back to you, somebody reach out to you. So that's one of the things that I will really continue to cherish. You know, even my staff, when they have an issue, sometimes I don't know what is it. I say, you can call, chat with them. And then they said, yes, they found it so easy. So easy. That's the strength. I think it's the biggest strength as well that HelloNote has. It's
support
that
is important.
communication, that support system. Yeah, that support. You don't disappear on people. You're right there to help, which is good. Keep it like that, you know. Keep it
We
like
will.
that.
We'll keep it like that. I know our team works really hard making sure that all questions are answered, and we always listen. So again, I appreciate Marie, appreciate your time, and keep doing what you're doing. So thank you very much.
Thank you so much. Thank you so much. Okay.
Thank you.
Bye.
Bye-bye.
Have a good afternoon.
You too.